Do you hear people kind of indiscriminately talk about the importance of core exercises? And I do my core work, and hearing different things about the importance of the core, whether it be for back pain or for shoulder issues or whatever it is going on, but you don't exactly know what that means. A lot of people use those phrases but don't really describe what they are. If that is something that you have some questions about or are interested in, then this video series is for you. My name is Biagio Mazza. I'm a physical therapist at Elite Physical Therapy, and this month's series we're going to talk about core exercises, the importance of core exercises, what they actually do, what is the core, and why it's important for your spine, your body, and what it can mean for your body if you have a weak core. So today we're going to talk about the top 3 core exercises that you can do as a senior. Now, is your body different as a senior than when you were in your 20s? For sure, there are things that are different, but biomechanically it's the same. So we can call these for seniors. These are all just basic things that if, because of the aging process, you've naturally had any kind of weakness or control issue in your core, then this can help to kind of reactivate it. We've spoken about the core in the past and said it's really a broad term, but we're going to kind of isolate it for the purpose of these exercises to just the low back. And for the purposes of our video today, we're going to go through 3 short exercises. ADIM is an acronym for Abdominal Drawing In Maneuver. What it basically means is it's not taking your stomach and bracing to where if you were going to get punched, you would hold yourself in that position. What it is it's actually taking and pulling your stomach up and underneath the ribs. Now, when I do that, I'm not holding my breath and lifting my ribs up. I'm really trying to leave my rib cage where it is and just take my abdominals and pull in, okay? Normally, when you are just standing, walking around, when you're functioning in life, okay, the abdominal should be holding you in between 25 and about 40%, okay? Meaning that if 0% is letting everything totally relax and stick out in front, that's not normal. 100% is as hard as you can pull in, just like you're walking around out on the beach and you want everybody to see a thin. Somewhere between the 25 and 40% range is where normal spines kind of should walk around. And people will argue with me and say, well, you can't remember to suck your stomach in all the time. And I totally agree. But it's not like we remember to hold our heads up all day long, right? It's not like we're walking around and our heads just drop and we remember, oh, I was holding my head up. No, that's not how the body works. You have to do it to kind of reactivate your body to do it correctly, and then your body remembers to do that in a lasting fashion. That's with everything that we do, is that it's really training your brain to continue to do the right thing that our bodies were designed to do, that many times age can diminish the ability for us to do that effectively. The second core kind of control exercise we're going to talk about is bracing. So bracing is another different type of kind of abdominal contraction. What you're going to think about with bracing is if you put your hands on either side of your waist, you want to think about squeezing your core to where your abdominals go wide, okay? So I'm not doing what many people do when I say contract your core is they crunch themselves down. That is not what we're talking about doing. That actually creates more compression on your back and can create problems. So what we're going to do is get your spine wide, okay? You kind of have to pull the stomach in, but you also contract the core in a way that will allow it to elongate. Many times with patients, I'll take my hands on either side and just say, push my hands away from you to be able to get that to occur. Now, there are a lot of different ways that patients respond when I tell them to do that type of contraction. And many people have a tough time getting it. Really, the best way that I have found is to use your hands, give that as a guide, and really try and push your hands away from your spine out this way. Okay? Both of these exercises I like to have people practice for anywhere between 10 seconds and a minute at a time holding. What that will do is that will help to build up a bank of memory for your brain to be able to help to control the contraction for longer periods when you're not thinking about it. So all that does is give you a kind of a reminder for what the abs should be naturally doing to stabilize the spine when you're lifting and moving. But it gives you a specific exercise. If you can remember, or if you can cue yourself to do that multiple times over the course of the day, that will create a lasting effect for longer term to where it gets easier and easier and easier over time. The final exercise, SLS, is an acronym for single leg stand. So a lot of people don't think about balance activities as a core exercise. But when you stand on one leg, okay, unless you shift your body to where you are falling over to one side, all the muscles in the glutes and the abdominals and the back have to contract to hold you there and maintain that position. In addition to that, we're getting some bonus bang for our buck by working on your balance, which has a whole other degree of control and other mechanisms that work for it. But standing on one leg really does work your core. So these are basics, but they're really fundamental things. Everybody wants to skip over and start doing planks and start doing, squats and crunches and all sorts of exercises. If you don't have the basics down, you're going to be building on top of a dysfunctional pattern anyway. Start with the basics. Get this down and then build that other activity on top of it. I hope you enjoyed today's video and you learned a little bit more about the core and maybe some specifics that you hadn't known before. If you are interested in learning more about your specific body and about what's going on with how your core is functioning, and you want to come in and do a free consult with me at Elite, just give us a call, 816-941-2550, or email me, biagio@eliteptkc.com.